Hi, this is Nancy, one of the Hospice Care Queens. I'm back to talk about whether to turn the oxygen off during the last 1 to 3 days of hospice care during active dying, when the patient is generally obtunded, possibly even comatose. Of course, our goal in hospice is to guide a patient through a smooth and comfortable dying process to their death. And let's remember, people can experience pain or discomfort when under anesthesia or in a comatose state. So our priority just has to be to carefully observe and assess a patient for comfort. Also, we know that oxygen is an external support system and it can therefore lengthen the dying process. The patient who has used oxygen chronically probably needs their O2 left on for their dying comfort. In that second group, that's the one that used it emergently. If it's only been used for a short time, PRN, we can consider carefully turning the oxygen down or off altogether. Very importantly, this must be discussed with the family or other loved ones so they are fully involved in this decision. Then the oxygen can be turned down a liter or two and the patient assessed for any change in their level of comfort. Did their respiratory rate increase? Did they suddenly start to open their mouth and gasp? Did the oxygen saturation drop down precipitously? If the assessment demonstrates stress and discomfort, well, of course, you're going to leave the O2 on and just leave it at the level it's been used. If there's no sign of change in the condition or comfort, the oxygen can be turned down, then reassess, turn it down further, and maybe discontinued. Again, please be so very sensitive to the family members and remind them dying is a natural state, and we don't want to extend the dying process with oxygen support. We want to allow the patient to pass just as naturally as possible. Please keep that in mind when you're faced with patients on oxygen, and then get our booklet, please. Use it at the bedside for every single patient. It individualizes the care for every patient, puts their information right at their fingertips whenever they need it. Go to our website and our YouTube site. We want to support you during the active dying state and any other time in hospice care. Thanks again. This is Nancy with the Hospice Care Plan. Care is treatment.